The lymphatic system. In vertebrates, the lymphatic system, also known as the lymphoid system, is an organ system that functions in tandem with the circulatory system and is a component of the immune system. It is made up of a vast network of lymphatic veins, lymph nodes, tissues, organs, and lymph. Lymphatic veins. It is the thick vessels connected to the arterial vein that absorbs the fat-soluble vitamins to get it back to the bloodstream. These are the three importance of lymph vessels: clear lymph, helping immunity, and transport fats. Lymph nodes. It collects the unwanted materials or pathogens that go through the lymph vessels. They contain a lot of white blood cells. Tissues. Comprising lymphoid tissue, lymphoid organ serve as the site for both lymphocyte generation and activation. These include the tonsil, spleen, thymus, and lymph nodes. Organs. It consists of spleen, thymus, and tonsils, which will be tackled later on. Lymph. It is the plasma that comes out and goes in between the cells. The lymph doesn't contain any red blood cells because they are too big for the holes of capillaries.
Today we're going to discuss into the amazing world of lymph nodes. These little bean-shaped structures are found all throughout the body and play a vital role in our immune system. You can picture them in clusters in the groin, armpits, and neck. Let's explore their function in more detail. Lymph nodes serve as immune command centers, collecting and eliminating pathogens such as bacteria and viruses, and filtering lymph, a fluid that carries immune cells and waste products. Why is this important? Well, enlarging or swelling lymph nodes are a signal of infection, inflammation, or other underlying problems. Physicians routinely check these nodes during physical examination, and they offer important information about general health. Diagnostic tools are used if there is a problem. Biopsies, CT scans, and ultrasounds are useful tools for looking into anomalies. Prevention is essential. In conclusion, lymph nodes quietly maintain our health. They are unsung heroes. Observe your body and don't be afraid to seek medical advice if something doesn't seem right. Cheers to the lymph nodes, the unsung heroes of our immune system.
The spleen. Spleen is a fist-sized organ found in upper left side of your abdomen, next to your stomach and behind your left ribs. It's an important part of immune system, but you can survive without it. Now, let's talk about what does the spleen do. The spleen has a few important functions. It fights any invading germs in the blood. The spleen contains infection-fighting white blood cells. It controls the level of blood cells. The spleen controls the level of white blood cells, red blood cells, and platelets, or small cells that form blood clots. It screens the blood and removes any old damaged red blood cells. If the spleen doesn't work properly, it may start to remove healthy blood cells. This can lead to anemia from a reduced number of red blood cells, an increased risk of infection from a reduced number of white blood cells, and bleeding or bruising from a reduced number of platelets.
Now, let's talk about the thymus. Thymus is a key organ in the lymphatic system and plays a crucial role in the development and maturation of T lymphocytes, or T cells, which are a type of white blood cell. The lymphatic system is a network of vessels, nodes, and organs that are part of the immune system and help defend the body against infections. The thymus is located in the upper part of the chest, behind the sternum, and in front of the trachea. It is a bilobed organ, meaning it has two lobes, and it is composed of both glandular and lymphoid tissue. The thymus is most active during childhood and adolescence. It tends to reach its maximum size during puberty and gradually decreases in size and activity with age. The primary function of the thymus is to support the maturation of T cells, a process crucial for the proper functioning of the immune system. During T maturation, T cells are produced in the bone marrow, but their maturation process is completed within the thymus. Immature T cells, called thymocytes, undergo positive selection and negative selection within the thymus. Positive selection. It allows T cells that can recognize self-antigens presented by the thymic cell to survive. Negative selection. It eliminates T cells that reach too strongly against self-antigens, preventing the development of autoimmune responses. Thymus role in immune response. T cells play a critical role in the adaptive immune response by recognizing and responding to specific pathogens, infected cells, or abnormal cells.
The little organs at the rear of our throats are called tonsils. They are an essential component of the lymphatic system and are vital to our general well-being. Previously, tonsils were believed to be a necessary and non-functional component of the human body. The tonsils, sometimes called palatine tonsils, are two soft tissue masses at the back of the throat or pharynx. If they get infected, they are typically surgically removed. Like the lining of the surrounding mouth, each tonsil is covered in pink mucosa and is made of tissue resembling lymph nodes. There are crypts or pits that run through each tonsil's mucosa. The tonsils are part of the lymphatic system, which helps to fight infections. However, removal of tonsils does not seem to increase susceptibility to infection. Tonsils vary widely in size and swell in response to infection. Tonsils are lymphoid tissues aggregate situated near the entrance of the digestive and respiratory tract and play a key role in our immune system.